Now to our mental health moment. Approximately 24 million people in the United States suffer from an eating disorder. It is among the deadliest mental illnesses, second only to opioid addiction, resulting in approximately 10,200 deaths each year. So here to discuss it is Lindsay Soucy, the clinical director for Sweetzer's New England Eating Disorders Program. Lindsay, thanks so much for coming in today.
Thanks,
we appreciate it. Yeah, so some people might be surprised to find out that eating disorders are a form of mental illness. So what makes it classified as a mental illness?
Yeah, so ultimately, eating disorders certainly have a medical component to them, so that's an important part of this. But what makes it a mental health diagnosis is that there is a thinking pattern that drives the behavior. So there's a distorted pattern in one's thinking that develops over time that then drives an individual to engage in patterns of behavior that are really unsafe. So that's what classifies it as a mental illness, is because what we're looking at is how can we make changes to the distorted thinking pattern to help make changes in the behavior.
Sure. So what kind of, are there different types of eating disorders?
Yes, there's several different kinds. So the ones that are most well-known, widely known, are anorexia nervosa and bulimia nervosa. Anorexia is really related to restriction, low body weight. Bulimia nervosa is going to be related to binging and purging behaviors, and then there's some other diagnoses that are related to strictly binge eating by itself, or versions of restriction that don't result in weight loss. So there's multiple different versions of eating disorders, and we treat all of them.
Yeah, so certainly it impacts everyone, or a lot of people, but is there a certain age that's impacted most by an eating disorder?
So in our program, we tend to, the primary sort of age group that we tend to see is between maybe 14 and 25, but eating disorders do impact all ages, all genders. So this is something to be looking out for really at any age.
And if you think maybe somebody needs some help, or you've noticed some changes in somebody's either behaviors or how they're eating or how they approach food, what should you do?
Well, the first thing is to talk about it. So we really talk a lot in our program about keeping it out of the secrecy. So getting it out of the darkness, talking about the concerns, asking really direct questions. And then if there's a lot of concern, if you know of a behavior that's happening, or if you've witnessed something, talk to your PCP, make sure you're reaching out to a therapist if you have one, and certainly reaching out for professional help.
All right. Thank you so much. Lindsay Soucy, the clinical director for Sweetzer's New England Eating Disorders Program. On your screen right there is the confidential eating disorders line that you can call if you need some help. We appreciate you coming in, Lindsay, for your insight. We greatly appreciate that.
Thank you so much.